everyone. Today we are talking about schistosomiasis bilharziosis with Dr. Ahmed Thabit. Introduction: a parasitic disease that is transmitted to human through contact with fresh water contaminated with larvae that penetrate the skin and mainly affect the urinary system or intestine. It caused by Schistosoma species bularis is common as tropical and subtropical area. The area effect is dependent on the parasite species and is predominantly the intestinal tract and liver or the urogenital tract. So, caused by Schistosoma species bularis. In our 5 species, Schistosoma mansoni, which caused intestinal schistosomiasis. Geographical distribution: Africa, Middle East, Central and South America. Major final host: human, other primates and rodents. Schistosomiasis hematobin, which caused of urinary bladder. Geographical distribution: Africa and Middle East. Major final host: human, other primates and rodents. Schistosomiasis maconchi. Major final host: human, dog and rodents. Schistosomiasis gibonacum. Geographical distribution: Southeast and East Asia. Major final host: human, ruminant, dog, rats and other rodents. Schistosomiasis intercolitum. Geographical distribution: Central Africa and major final host: human and sheep and rodents. In the hilly area of China and in the Philippines, they are predominantly dogs but also rat. Reservoir and host range: human are the main host for Schistosomiasis hematobin, Schistosomiasis mansoni and Schistosomiasis gibonacum. The role of animal reservoir seems of minor importance in the case of Schistosomiasis hematobin, but baboons and other monkey species, pig and various rodents may be involved. Various monkey and rodent species act as reservoir host for Schistosomiasis mansoni. Zoonotic relationships are most pronounced with Schistosomiasis gibonacum reservoir host or domestic ruminants as water buffalo and cattle. Transmission route to human: the infection stage of schistosoma consists of Cercaria swimming in water and invading the final host percutaneously. Schistosoma eggs are excreted with feces or urine by infected final host. They contain ciliated larvae that hatch when the egg come into water and invade aquatic snail as intermediate host, predominantly in shallow water zones. Life cycle of schistosoma. On the life cycle of schistosoma, so if we start at the egg stage, the eggs can be carried in the feces and urine from infected individual, and this from infected individual, and these eggs can be released into water and hatched into what we call meriscedia. Meriscedia can then penetrate into snail tissue. So the meriscedia can then penetrate into the intermediate host. The snail eventually, what we call sporocyte, begin to accumulate in the snail, and then cercaria are released from the snail and into the water, and this cercaria are free swimming, and these are what can actually penetrate, and they can penetrate into the skin. So when the person is walking through the water, the cercaria can enter and penetrate into the skin, and they lose their tail and become a schistosoma lay. The schistosoma we can then enter the circulation of the infected individual migrate to the portal blood on the liver, and they mature into adult, where the adult worms can then migrate into the mesenteric venules of the below and rectum. They lay egg, and then this egg can be shed in the stool, and then into some water source, and then the cycle can begin again, and that complete the life cycle of schistosoma parasitic blood fluke. A clinical manifestation. So what are some of the symptoms in acute infection which typically occurs in travel going in some of this affected region? The individual can get what we call a swimmer's itch or an itch rash from the penetration or surgery into the skin, and it can look something like this. So you get this rash if you are being in contaminated water, and during the acute period of infection we can see this syndrome known as acute Katayama fever, and this we will talk about this in another lesson. But this is due to an immuno reaction to this parasite and can lead to a different subset of symptoms. Now, most of the symptoms we talk about chronic, and schistosomiasis is due to a chronic infection, and the chronic infection is due to ongoing exposure of the parasite, and they are produce egg. And the disease severity itself is released to the number of egg and the tissue distribution of the parasite, and the egg now depended on how many egg are in the intestinal tract. We can see different type of symptoms within the intestinal tract. Some of them include a chronic or intermittent abdominal pain. This individual can also experience poor appetite. They can have diarrhea, they can have intestinal bleeding, and the diarrhea intestinal bleeding can lead to a iron deficiency, anemia, some of the other symptoms of Katayama. But with diagnosis, it is important to check serology, so look for antibodies. That is particularly important in travel. It is important to do a urine analysis. We have talked about how some species can release their egg in the urine, and it is important to do a PCR to check for parasite genetic. So it is important to check this for diagnostic criteria to see if this individual are in fact infected with schism parasite. What are some of the treatment? Well, the treatment for Katayama or belt reside so presequental is actually anti-helminthic or anti-helminthic, anti-against helminthic. It is against this parasitic worms. So it is a drug that can kill this parasitic worms, and the dose of typically 20 milligram per kilogram is needed. Their time daily 4 to 6 hours in travels for 1 day would be treatment for this individual. Prevention and control mature. Avoid contact with contaminated fresh water in endemic area. Improve sanitation, a proper disposal of human waste to prevent contamination of water source. Provide safe drinking and bathing water. Control snail population using environment management or molecularicides. Health education to increase public awareness about transmission and prevention. early diagnosis and treatment of infected. Public health importance. It is a major parasitic disease affecting millions of people, especially in tropical and developing countries. Causes chronic illness leading to anemia, weakness, and reduced work productivity. Can cause serious complications such as liver virus, bladder damage, and kidney diseases. Associated with poor sanitation and contaminated water, making it is indicator of public health condition. Anyway, guys, that was a lesson in schistosomiasis, and thank you.